forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everyone, welcome to our new program and the COVID studio, which are the educational programs of Imam Reza Hospital. Today I'm honored to host my professor and actually my boss, Dr. Mehdi Farhoudi, who's a neurologist, a professor of the Tabriz University of Medical Sciences. Welcome, dear Dr. Farhoudi. I'm so happy that you are here. I'm going to talk to you about your educational program. Please first introduce yourself to our audience.
In the name of God, thank you for your invitation. I am Mehdi Farhoudi, Professor of Neurology in Tabriz University of Medical Sciences. I have received the stroke fellowship from Calgary University in Canada. I am head of a stroke program in Tabriz University of Medical Sciences, and also I am vice chairman of Iranian Stroke Association, and I was a board member in World Stroke Organization for 8 years in period of 2014-2022.
Great. I'm sure that everyone in Iran, of course, knows you, but for our foreigners, they should know that Dr. Farhoudi is really an expert in the field of stroke. And I know that the program that we are going to talk about, the title is Tabriz Stroke Fellowship Program. We will talk about it and we will provide an overview of what will be covered in this course and what the participants will gain from taking this course. Can you tell me about the importance of this course?
Okay. As you know, stroke is a life-threatening disease as a second cause of mortality worldwide, especially in developing countries. But unfortunately, stroke is a treatable disease by some ways, such as thrombolysis, thrombectomy, and admitting in stroke care units and good management. If we consider this, we can treat about 50% of cases. It is very important. In the other side, stroke is primary preventable disease, about 80 to 90%. If we consider risk factor and control them, we can prevent this disease. Because of that, it is very important to update our knowledge and practice about that. And this program, Tabriz Stroke Program, I think it is an important approach for developing our knowledge and practice about stroke.
Thank you very much. You mentioned really significant percentage. As you said, 50% is curable if they are in hospital and stroke units, and 18 to 90% preventable. It's really significant. And now let's talk about your course objectives. What are the objectives, and anyone who participates, what will learn from this course?
Okay. By applying these courses, we can aim to learn about this issue, neurosonology, including transcranial Doppler, cervical Doppler, microemboli monitoring, shunt study. All of this we can receive by neurosonology devices. Other one is how to measure NIHS and MRS scores. It is very important in stroke management. Other one, thrombolysis of eligible acute ischemic stroke cases, and other one, management of TIA cases and acute stroke cases, subtypes. It is very important to know about management of this better. And other aim is outpatient cases. Usually we can learn about that more in stroke clinics. And other one, secondary stroke prevention. It is very important. After time when stroke occur, secondary stroke prevention is very important. And by the end of these courses, applied neurologists will be able to update medical management of all stroke cases. And this course is designed for neurologists who are interested to receive and learn about special skills about stroke management.
That's great. And what about the course overview, the timing of the course, and maybe the parts and modules in the course?
Okay. We designed these courses in two parts. In basic and medical part and advanced part. In basic and medical part, it is included about medical management and takes about 12 months. And in the advanced part, we consider using diagnostic digital angiography and thrombectomy. In this situation, additional 6 months is needed.
Okay, so totally will be 18 months to complete the course.
Yes.
12 months for the basic step and 6 months for the advanced course.
Okay.
Great.
In basic or medical part, the course included these ones: visiting acute stroke cases, activated as a stroke code in emergency department, and following related diagnostic testing and imaging and probable thrombolysis intervention. Other one is a regular participation in morning reports of stroke cases. We have usually this one, visiting in a stroke clinic and taking part in weekly stroke cases ground round, and guideline reading, some presentation by stroke fellows, and other one, participation of some research related to stroke. Other issues about interpretation of CT angiography, MR imaging, TEE, Holter monitoring, and working by neurosonology devices, as I said, to study cerebrovascular system in different issue. And in the end, botulinum toxin injection of spastic muscles, and all included in 12 months in the basic months.
Okay, and what about the advanced part of the course?
Okay, in advanced part, as I said, it takes 6 months. Mm-hmm. In this part, applied neurologists, we can work with digital subtraction angiography, DSA system, and as a hand-on, and can use about thrombectomy, can work about thrombectomy and other issues.
And there is just a question for me, as this is a long duration program, actually because it's a fellowship program, how many times the fellows are expected to be in the field?
Okay, usually about fellows expected in applying in this program, expected to spend times about 8 hours daily, and be active in on-call programs. Usually we schedule in stroke care unit, SU ward.
Okay, that's great. And just I want to know about the key concepts covered in this course. If we want to name the key concepts, what are they?
Okay, I consider in this part 4 items, I think. Diagnosis and appropriate management of acute stroke patient, it is very important. Other issue, optimizing team working about a stroke, because a stroke is an interdisciplinary issue and it is very important. Third one is gain capability about reading and interpretation of stroke-related imagings, and in the end, making the best decision for stroke cases. It is very important. All of these issues aim to have a good outcome in our patients.
And I wanted to know about your expert team, any of your colleagues who will collaborate with you in this course?
Yes, as I said, our program is an interdisciplinary program. In addition me, other colleagues are Dr. Eliar Sadiki, is Associate Professor of Neurology, Fellowship of Interventional Neurology. Other one, Dr. Jawad Jalili, he's Associate Professor of Radiology. Again, it's a Fellowship of Interventional Radiology, working together. And from other department, Dr. Reza Bahrami, he's Assistant Professor of Neurosurgery. He has, again, Fellowship of Intervention. And the other one, Dr. Muhammad Basir Abul Qasim Fakhri, is Associate Professor of Surgery, General Surgery. He is working with us about issues of carotid endarterectomy.
Great, you have a great team, all well-known professors in the field of stroke. Thank you very much for being with us. If there is any other thing that you want to say, we'll be happy to hear it.
Okay. In the end, I'd like to say that it is our very great pleasure that informed that our stroke program in Imam Reza Hospital received a status, diamond status of World Stroke Organization Angels Award in 2022 and 2023.
It's really great and a really great achievement. I should congratulate you and your team. Thank you very much for being with us and giving your precious time to us to have this program. I also thank anyone who is listening to us, and if you have any other question regarding this program or any other programs of Imam Reza Hospital, you can contact us via email or you can visit our website that you see in the subtitle. Thank you very much.